Valerie Wilson, Director of the Caribbean MedLabs Foundation, welcoming you to an excerpt of our webinar on HIV self-testing done in collaboration with the Caribbean vulnerable communities.
So what is HIV self-testing? And many of you may be aware already, but we just, for those who may not know or those who may need some clarification, HIV self-testing is a process in which a person collects his or her own specimen, whether it is oral fluid or blood, and performs a test and interprets the results. And they can do this in private. They can do it with someone who they trust. It can be done with a healthcare worker whom you trust or with a partner. So there are many ways in which you can do it. But the point about it is that it is actually being done by the individual themselves. And the World Health Organization has actually pre-qualified some HIV self-tests. There are only 4 self-tests on the market that are WHO pre-qualified, meaning that WHO has done the testing on these kits and has verified performance levels within environments where the WHO has done the testing. So the blood kits that are actually pre-qualified by WHO are the SureCheck kit, the Mylan, and the INSTI. And then there's only one saliva test, the OraQuick test, that has actually been pre-qualified by WHO. So who and how can HIV self-testing assist in our work within the region and for the populations within the region? The WHO HIV self-testing can assist many different populations within the region. The general population, of course, for those persons who may want to test, and in fact, it's anybody who wants to test but may not want to go directly into a health institution. And these populations listed here are really from the WHO self-testing guidelines that came out in December 2016. General populations, pregnant and postpartum women, couples and partners, adolescents who may want to test, young people, key populations, of course, and any vulnerable populations who may actually need and want to do HIV self-testing. We know how can it assist. We know that HIV self-testing, or not HIV testing in general, actually, and I mean, COVID-19 has raised testing into, the eyes of the world, but I think those of us who are working in or have been involved with HIV programs or involved with HIV personally know that testing is the cornerstone of the prevention services. The COVID-19 pandemic has unfortunately interrupted HIV testing services because of lockdowns. Persons may not have access. Persons may be economically challenged as a result of these lockdowns and not be able to come out and access testing. Many different things. Sometimes, in some cases, the testing sites have been reallocated for other things given the COVID pandemic. So it has interrupted HIV testing in some cases. And we do need innovative strategies such as HIV self-testing to expand access to testing as a result. So in a sense, the COVID-19 pandemic has driven us to think more about where and how can HIV testing be incorporated into what is our HIV testing strategy within the Caribbean region. And when we look at who can this benefit, this data, this infogram was just recently put out by PANCAP, looking at HIV in the Caribbean at a glance, the 2019 data. And it showed that when we look at the KP, well, in fact, at the general population in terms of the cascade, we see that 77% is estimated in the Caribbean, where we want to reach 90, that 77% of the people living with HIV know their status. So we're actually starting already with a significant deficit in terms of people who know they are infected. And then with respect to those who are on treatment, 81% of those, and then of those 80% who are on antiretroviral therapy and are virally suppressed. So, and it's estimated that there are 330,000 people living with HIV in the region. So if we are falling short of that first 90 by 13%, then that's really a significant amount. And therefore, we really need to address how do we close that gap. So the WHO HIV self-testing guidelines in 2016 actually came out with what were new recommendations at the time, and I left that on the slide because it was new at that time, that HIV self-testing should be offered as an additional approach to HIV testing services. And this was actually because it was recommended, but we have not actually implemented within the Caribbean. For us, it's actually really a new recommendation that we're looking at within the Caribbean and how this can be implemented. And the discussions are underway with PANCAP, with PAHO, with ourselves in terms of looking at, and with CVC in terms of looking at how HIV self-testing can be rolled out within the Caribbean. So the WHO HIV self-testing strategy is very important to understand where HIV self-testing fits in the scheme of things. When an individual would perform an HIV self-test, they will test either a positive result or a negative result. They'll get a reactive or a negative result. If they have a reactive result, then it is very important that they actually get linked into HIV testing for the purpose of ensuring that they actually are positive. These tests are calibrated and these tests are made so that they would actually tend to err on the side of giving you reactives in persons who may or may not be positive. And therefore, it's really important to make sure that the test that comes up reactive in the hands of someone doing a self-test is a real positive. And that is a very, very important thing that anyone who's using a self-test must understand. Likewise, if you get a negative, there may be need for retesting depending on whether the person feels that they have had a recent exposure or they have risk factors. And of course, the linkage to prevention services is really important. Any person who is actually uncertain about their HIV self-test results should be, of course, accessing facility-based or community-based HIV testing. So the need for ensuring that people understand where self-testing fits is a really important key in terms of our trying to decide where and how do we fit HIV self-testing into our regional landscape. Self-testing is definitely not recommended for persons who are taking antiretroviral results, as that can cause a false non-reactive result. But in fact, we really need to understand self-testing, and that is why it's really important for us to understand, for example, the whole idea of a window period. Persons who may take an HIV self-test may do that because they've had a recent exposure and they want to know, how I was exposed, am I HIV positive? We all need to remember the lesson about window period. We talk about it all the time. It's really a period of time, and you see this, it runs into weeks. This illustration actually shows us that for 3 weeks after infection, it's only at that point that HIV antibodies start to rise. And even if they're rising at that time, it does not mean that they would be sufficient for the test to pick it up. A test can only pick up when you reach a certain threshold. There are other tests that can be used earlier, things that would measure DNA, things that would measure the antigen. But when we're talking about a self-test, the self-test actually measures antibodies, which is the test, the same as a rapid test that you would go for in a community-based testing site or a health service testing site, measuring antibodies. And when you're measuring antibodies, there is a significant window period that you have to take into account before you can even expect the test to be reliable. So the objectives of the WHO HIV self-testing guidelines that were developed in 2016 were to support the implementation and scale up of self-testing and assisted HIV partner notification. and to provide guidance on how it could assist in and how it could be integrated into services. It was really, the guidelines are intended to support the introduction of HIV self-testing as a formal intervention in countries using WHO quality assured products and quality assured products that are approved by local and international bodies. So even though you may have WHO pre-qualified tests, it is important that you have local and international bodies approvals for these tests to be used in country. And of course, it is really intended, the guidelines were intended to actually position HIV self-testing and assisted partner notification to contribute to those achievement of those 90-90-90 targets and the 2030 targets, which are even higher at 95-95-95. So this was the idea behind HIV self-testing. And so one of the things that we are looking at within the region is to look at the use of these HIV self-tests in reaching people who may actually be undiagnosed with HIV. And we are looking in the region at using the oral test that I mentioned earlier, the oral quick test, which actually does not require you to take a blood sample, but it actually uses saliva where you're actually checking for antibodies. And so it really allows those persons who actually want to test themselves and to test in privacy to do so. You have two different kinds of HIV self-testing. It's important to think about how we actually will utilize the self-testing. You can actually have directly assisted HIV self-testing, and as we're introducing, this is the way that we're thinking in terms of introducing the HIV self-testing, that a trained peer, so somebody who is in one of the organizations, CSO organizations that supports key populations, someone who is a trained healthcare worker, would provide a brief demonstration on how to use the test and how to interpret the results. And of course, provide either face-to-face or some kind of online instruction while persons are using the kit. And the instructions would actually be included with the kit to provide whether it is just written pictorial kinds of representations or video type and so on. And we're looking at a mix of those kinds of supporting materials. Unassisted HIV self-testing is where the instructions are included in the kit and people just take it home and they do it on their own. And that may take place at a later stage, but we're really looking at the peer-assisted to begin the process. So when we talk about HIV self-testing, you can think about HIV self-testing in the context of how do we actually, deliver HIV self-testing. And there are many different ways it's being done internationally. This is at WHO, and I'm sharing with you some WHO slides at this point, as you would have noticed. WHO actually has looked at community-based models, partner-delivered models, facility-based models, which is the sort of peer-assisted and healthcare worker-assisted model. Then you have pharmacies that can actually sell HIV self-test kits, and we know that happens in the region and even outside of the region, where people can actually order and have their own self-test kits delivered to them from outside of the region. You have workplace programs where people may be given HIV self-test kits, and it could be integrated into STI treatment, reproductive health services, and so on. And then you have those that are more sort of internet-based, supporting pre-exposure prophylaxis type programs. So these are the ways in which HIV self-testing can be delivered. And of course, you have things like vending machines when it becomes that well-known and so on, where you actually can integrate into the system. As we start, as I said before, we are looking at starting slowly and not trying to do everything at once. Just some data to share with you, the WHO data that has actually indicated how self-testing has helped. In across studies in Africa and in America, Asia, Europe, where they've actually been using HIV self-testing, they found that HIV self-testing can identify 2 times as many HIV infections as standard HIV testing services. So this actually is a major step in terms of being able to scale up HIV testing, and that actually is a really important factor. And looking at the positivity rates that, in terms of the positives that are picked up through this use of HIV self-testing, it ranged from 3 to 14% among the general population in sub-Saharan Africa, and between 1 and 30% among key populations in Africa, America, Asia, and Europe. So it actually really allowed the identification of persons who are infected and who may very well be persons who do not know that they are infected and who need to be engaged in coming into the care for HIV before they actually progress to further circumstances. In terms of linkage to care, we actually have a slide here that shows how linkage to care has actually been achieved, because this is one of the issues that I think was identified early on when you took the poll question. The whole issue of, okay, when people actually get a reactive result, are they going to come into care? And they actually have data that shows that you really have very high percentages of persons who actually, in the general population, somewhere between 50 and 56%, and 20 to 100% among KPs that actually enter care, who actually enter care, get their result confirmed, because before anything happens with HIV self-testing, remember, if you have a screen positive, it is simply a reactive result, and you have to have confirmation using the national algorithm before you can actually say that this person is truly HIV positive. So those persons who may have a reactive screen, it's really important for them to go into the health services and be properly tested, adequately tested, and then taken into care and treatment as necessary. The other issue that I think people were concerned about, there was some concern about violence. And in fact, this again, all this data is coming from WHO, and they actually showed that there was no identifiably increased risk of social harm and adverse events. And they have actually been monitoring this for quite some time with respect to those countries that have actually, and in fact, countries that actually implement self-testing. Part of the implementation is actually to look at the post-surveillance so that you can actually see what happens. Is there any violence, partners, forcing others to be tested and so on. So these are reports from studies. They did not suggest any increased risk of harm. In Malawi, they actually had 2 years of implementing HIV self-tests. No suicides, no self-harm, no cases of partner violence. Reports of coercion were identified were mostly among men who also reported that they would recommend HIV self-testing. So there may be some coercion. All these things actually are things that would have to be tracked to make sure that they're not actually becoming an issue within the populations that are served. In Kenya, they did note on this slide that you can see that 4 cases of partner violence were identified, but it was unclear whether they were due to HIV self-testing. So the principles that HIV self-testing must uphold are that they must adhere to the World Health Organization 5 C's of HIV testing services. That is consent, confidentiality, counseling, correct test results, and connection to the health services as required. So they must also address country social and legal barriers to access and uptake the HIV testing services. And that's one of the reasons why you would see that we're actually looking at, in the introduction, how are ministries of health going to be engaged? How are we going to ensure that HIV self-testing becomes an accepted part of the policy framework for HIV testing in these countries? And how do we support people in testing so that they can actually get the counseling, the information that they need, that they get correct test results, that they understand what the test means, and that they actually are connected to the health service if necessary.